prolactin, there will be excess, because excess prolactin, and it leads to gynecomastia, which is increased breast tissue, pain, and lactation. It will also cause sexual dysfunction in both men and women. I'm trying to think, have I forgotten something? I'm sure it will come to me if I have. And then there are also arrhythmias, which can be picked up using ECGs. Usually I think the arrhythmias that is usually related to a drug such as clozapine is prolonged QT syndrome, which really just means that if you were to look at an ECG, an ECG will have the P wave, the QRST, obviously this is the wrong way of my ECG. So really, this is the PQ. I've elongated it in a way, S and T. So what really means by prolonged QT is that this bit of the ECG is longer. By saying longer, really, the easiest way to define it is that normally, if we were to take an ECG print out, the QT interval, so the QT interval is usually about 9 to 11 small squares. So really, if it's elongated, obviously then it's longer, and then that means that there will be ventricular arrhythmias. And of course, things such as Torsades de Pont's, VF, blah blah blah. But then obviously, that's not my main goal right now to in this talk. However, yeah, so there will be the prolonged, like this in normally when you look at an ECG printout, it's normally that. And the best the best lead for identifying this will be lead number 2, simply because lead number 2 is actually on the cardiac x-axis. And all what this means is that, if we look at the heart, like that, And if we're to look at the left ventricle there, so in terms of ECG, the way I think I should do this is that in terms of ECGs, the lead 2 looks at the left ventricle. It is there really. So it's looking directly at the left ventricle, and it's receiving, the electricity comes in from AVR, which is on the right. So AV left will be there, and then the foot F will be there. And if you like, lead 1, which is sort of here, is at 90 degrees of I don't know why I've done that, because I just wanted to draw 90 degrees perfectly. Lead 1, so it's here, is at 90 degrees to AF, and this lead 2 is mostly at 60 degrees, so it will be here. So again, we're basing this on the left ventricle, and lead 3 is obviously 120 degrees, so there. However, lead 2 will always have a positive deflection, because all the electricity is coming in from there and going towards the left ventricle. Again, I have covered, impulse generation in the heart in one of my medical talks. But then it will always have a positive deflection, and positive deflection means that R is always upwards, and it's always the tallest wave when you're looking at an ECG, whereas AVR, for example, in AVR, the R wave will always be negative because the electricity is flowing away from it. So really, when we're to look at that and notice that there is a prolonged QT interval due to someone perhaps having clozapine, then that can be managed well, because things like arrhythmias cause things like strokes, irregular heartbeats. They can also cause tachycardias, bradycardias. So they will need to be managed. What else do I need to say about schizophrenia? So I think the take-home message really is that people with schizophrenia die earlier than people without. And the main thing really is that what they die from are modifiable and preventable or treatable, really. Shall we also say treatable? Modifiable and treatable diseases, which are all there, and modifiable risk factors, which are there, and there is also suicide, which can also be treated in terms of the psychiatric arm of management. So, and then, what we are focused on here really are the physical health problems. And really, that is it. So, really, in terms of what is schizophrenia, it is a psychiatric condition that's severe, chronic and disabling. It has psychosis, it has reduced cognitive function, and there is also abnormal behavior, abnormal speech, and reduced understanding really of reality. And there are positive and negative symptoms. However, the most important thing really, the take-home message is that people with schizophrenia die so much more earlier than people without schizophrenia, and all of this is due to modifiable risk factors and preventable or treatable diseases which are part of their physical health. So with routine checking, all these diseases can be picked up and treated. With routine, routine physical checks, all of these diseases can be picked up and treated. And hopefully that will then reduce mortality and ensure that when someone is being treated, they can then return to normal life and function. And that's it really. Thanks.